New at 9, a continuing controversy in the northern suburbs. Vista Medical Center in Waukegan lost a crucial trauma designation.
Tonight, we're hearing from both sides on the issue. WGN's Brona Tumulty joins us now with the story. Brona?
Good evening, guys. Yeah, it's been quite a few weeks of hearing all about this controversy, but tonight we finally had a chance to sit down with someone from both sides.
I feel like I blew down this house of cards.
Leake County Coroner Jennifer Bannock has been at the centre of recent scrutiny surrounding Vista Medical Center in Waukegan, purchased by American Healthcare Systems of California back in July.
They believe in turning around small, rural community and inner city hospitals.
They own 4 hospitals, and at the helm here, CEO Bianca De Filippi.
No turnaround happens in 6 to 7 months. Typically, you're looking to a year to 2 years.
But let's rewind. Bannock, who previously did contractual work at Vista as a nurse anaesthetist, says her concerns started growing as birth rates dropped.
Between October, November, and December between 2022 and 2023, if you look at them, it's maybe about 60%.
Last November, for example, 20 babies were born there, compared to 88 12 months prior. But she says services were dwindling too.
I would say around November timeframe approximately, we became aware, or there were some rumors that the urologists that were on staff, that they had received payment and it was returned for non-sufficient funds. And eventually, those practitioners resigned their privileges.
Do you know why the urologists left?
I think there's a multitude of different reasons, and I won't speak on their behalf.
That issue, we're told, raised in a December interagency meeting.
At the meeting, I asked Ms. De Filippi a couple of questions, and one of the questions or the concerns that I voiced was their ability to meet their financial obligations.
And what did she say?
She said, "We've never missed a payroll."
We were never not paying physicians, but delayed in our payment.
That's different from what Faisal Hill told me last week. He told me that you have never missed payroll.
Well, I want to make a difference. We have never missed a payroll. These physicians are not employed by the hospital, so they're not on our payroll. They are 1099 contractors, in which we were delayed on payments.
One of the people contracted was Dr. Jonathan Sito of the American Center for Spine and Neurosurgery, who told WGN he stopped working at Vista after not receiving payment for 6 months.
We are committed to paying those back.
Now, Bannock says she, at the bequest of a hospital board member, drafted a letter in December about her concerns. When did you see that letter?
I could not say a date that I remember receiving the letter from a different board member.
About a month later, we're told she was walked out of the facility.
I love taking care of the patients. I'm sorry.
Part of our responsibility with the contract we hold with that anesthesia company is to request anything that disrupts operations of the hospital. We have the right to ask that individual no longer be on the schedule.
So was that the case?
Yes.
At the beginning of February, the Illinois Department of Health pulled the hospital's Level 2 trauma certification, which Bannock says proves problems are there.
At no point has there been a risk to patient safety or an inability to provide care for trauma patients.
Okay. I think one of the things IDPH listed, though, was like a lack of a blood bank or a lack of a sufficient blood bank. Would that not, by default, mean that the care was lacking on some level for Level 2 trauma patients to come here?
And we've submitted an appeal to that in stating that we did not feel that was accurate.
So what does the future look like? Well, we're told several new doctors are coming on board, like Chief Medical Officer Mary Maish. How long have you been here at Vista?
Just a little bit more than a month.
So you're brand new?
Brand new.
How's it going so far?
Great.
And as of February 10th, urology is back up and running.
That we have signed our former urologist group. They have come back to Vista, and we're happy to have them back.
De Filippi stressing a commitment to getting everything back on track.
We understand our mission and that we have a patient population that we want to serve and that we're committed to serving and that we're capable of serving.
Another doctor telling us today he left the hospital yesterday and is still owed just shy of $50,000. IDPH also adding tonight that it stands by its actions to date and will continue to work with Vista to address the issues that they have identified, quote, affecting the safety of patients. Dina, right?
It's frightening.